Hello, everyone. Good day, and thank you for joining us. My name is Efe Aigbede, and it's a pleasure to talk about this system. I'll be discussing today the SGA National Drug Alert System, a system that I, alongside my team, have designed, the Accidental Drug Poisoning Crisis Community of Practice Program. It represents a pivotal initiative in harm reduction, and I'm excited to share more about it with you today. The National Drug Alert System is a comprehensive platform addressing the critical need for drug safety in our communities. It's developed in response to the challenges posed by the toxic drug supply across the country. It represents a concerted effort to gather and disseminate information about drug trends, and its primary aim is to reduce harm caused by substances and to inform people who use drugs about what is in their supply. The system serves as a central hub for data collection and alert dissemination, bridging the gap between health services, harm reduction agencies, and the public. In this talk, we'll explore its roots, its functionality, who benefits from it, and its crucial role in our community. I will also demonstrate how to receive and interpret alerts for safety purposes and walk you through the dashboard and focus on some of its uses. Gathering information about the toxic supply was a challenge, but it's also an opportunity to initiate conversations about reliable alert systems in different provinces that lacked them, sharing of alerts in a world where there's so much to share and so much to be aware of, and safe supply conversations. We reached out to harm reduction organizations and drug checking agencies across the country. These groups on the front lines interact directly with those affected by the opioid crisis. Working with harm reduction organizations is also very crucial for disseminating the alerts that we receive. Each organization contributes unique perspectives. Harm reduction organizations contribute anecdotal evidence, and drug checking agencies offer scientific data from drug checking by advanced technologies like the FTIR machines. This combination of grassroots insights and scientific data forms the backbone of our information gathering. Verifying crowdsourced information is also very crucial, which is why we only work with trusted organizations. We engage in a feedback loop with contributing organizations, ensuring data accuracy and relevance. Building trust and ensuring that the disseminated information is reliable and actionable is also very key. One challenge with sharing alerts is that reports often require confirmatory testing before public release. But by partnering with harm reduction organizations, we can access information more promptly even before confirmatory testing is done to ensure timely dissemination. The SGA National Drug Alert System represents a significant step in addressing the challenges of unpredictable supply by providing crucial, timely information to those who need it. This proactive approach helps us address the issue of drug safety with a sense of urgency, which is essential in the context of the ongoing unregulated drug supply. The immediacy with which we can relay information about potential dangerous drug batches can often be the difference between life and death, and we believe that the SGA National Drug Alert System can not just only be a tool for information dissemination, but a way for us to track the trends of drug supply throughout the country in one unified platform. Let's delve into how the SJA National Drug Alert System came into being. It began with a series of national summits in 2021, where diverse voices, people with first-hand experience of opioid use, community members affected by the crisis, staff from various programs, and government officials gathered to find solutions to the unpredictable drug supply. One of the main challenges identified was the need for current information on drug trends. It is underscored by the worsening opioid crisis and unpredictable drug supply. Responding to this need, the Accidental Drug Poisoning Crisis Community of Practice saw an opportunity to create a centralized system to deliver crucial drug alerts timely and effectively. It was launched on December 12, 2022, and it stands as a collective commitment to combat the lack of coherent sources of drug trends and alerts. It consolidates pieces of information into one accessible platform, ensuring those at the forefront have the information they need to safeguard their communities and, more importantly, make informed decisions. The system is not just about alerts, it's about connecting, empowering, and protecting our community. Our strength really lies in our partnerships. We currently work alongside 11 dedicated partners across Canada. We've covered such a wide scope in such a short amount of time. The only province that we do not have a partner in currently is Quebec, and we only partner with one territory, Yukon. But it's still very impressive given the amount of time that the alert system has been operating. On the right side of the screen, I have a flow chart of how we receive information into the national database and how we disseminate the information as well. So when community partners are notified that an accidental poisoning or adverse reaction has occurred in the community, they feed that into the National Drug Alert Database by completing a online geospatial form, as well as our drug checking partners. I also feature some information from news publications and existing alert platforms, and we disseminate those pieces of information by sending out alerts, by representing those alerts in our geospatial dashboard, and covering other news publications or existing drug checking services like BCCSU or CDPE, older information in our bi-monthly release in the ADPC-CoP newsletter. Since the launch of the National Drug Alert System, we've had substantial engagement, which is a clear indicator of the system's value and impact. Over 1,600 unique individuals have accessed the system seeking vital information. Over 200 people have subscribed to receive regular updates, demonstrating a commitment to stay informed. And over 250 people have 267, and these figures are from December 12, 2022 till our 1 year anniversary, December 12, 2023. They've increased since. So we have 267 people who have accessed our bi-monthly drug trend reports. We also carried out a survey in September and found out what users have to say about the National Drug Alert System. It was hosted on the dashboard on our website, and 90.7% of users agree the alerts are timely. Knowledge enhancement is another significant impact. People who use our system, 93.7% of them, report increased awareness of drug supply in their province. 85% of people who use the system would also recommend it to others. 9 out of 10 people also agree that the system is user-friendly. Now let's talk about why all of this matters. Our system is pivotal in informed decision-making, providing timely awareness of drug trends, and enhancing response strategies in various settings. It's not just about providing data, it's about fostering an environment of education and information exchange where knowledge is shared and strategies are developed collaboratively. The timely information we provide empowers communities, encourages proactive approaches to drug trends, and community empowerment is critical in our fight against unregulated supply. Moreover, the data that we gather supports and can be used for policy and research guiding public health strategies. Finally, our advocacy for safe supply solutions is bolstered by the data that we collect. In a landscape where the drug supply is increasingly unpredictable, advocating for safe regulated alternatives is more important than ever. Now, how do you access these alerts? Staying informed about drug alerts is vital to keep our communities safe, and accessing these alerts is straightforward and free. I'll guide you through the 3 different ways you can access them. One is the email subscription list, social media, and our interactive dashboard. First, you can sign up on our website. It's a quick and easy process. Once you visit the React and Reverse websites, click on the National Drug Alert System drop-down, and there you'll find our dashboard, and at the bottom of the page, our sign-up form. You just need to answer a few questions, your name, email address, and choose the province or territory you're interested in receiving alerts for. After that, you just hit subscribe, and we'll send you notifications about the substances identified in your region. You can also access alerts on our social media platforms, Instagram, Facebook, or Twitter. On Instagram, most especially, we collate a monthly report of all of the alerts that have been submitted. On our social media platforms as well, you will not only receive alerts, but also updates on other programs and resources that we offer. Our interactive dashboard offers a detailed map featuring all of the alerts that we have received. Each pin on the map represents an alert and provides in-depth information, including what the substance was sold as, its actual contents, and associated risks. Now we're going to walk through what an alert means. So the first picture is a pop-up on our dashboard. So when you click on a pin on the dashboard, this is the pop-up that you see. And these are the alerts that we send via our email subscription list. And this is what you also see when an alert is posted on social media, Facebook, Instagram, or Twitter. The first section of the alerts that I would like to talk about is the date of the report. So this date tells you when the alert was created or when the alert was reported to us. The recency of the report is crucial because it reflects the current risks associated with the substance in question, and it also helps to gauge how timely the alert is. Now, you understand that one of the major problems with alerts that are being submitted by some drug checking organizations or even public health organizations is the lag time in posting the alerts. But as soon as we get alerts and we've completed our feedback loop process, we post them as soon as we get them to enable us deliver alerts as real time as possible. So the next section of the alerts is the website. The website of unfortunately, the name of the organization on the left side of the screen of the map pop-up has been cut out, but we usually state the name of the organization who sends in the alert and their website on both examples of the alerts in front of me. The source of the alert is usually a partner organization only. We only receive alerts from either harm reduction organizations and drug checking organizations. And this is typically because we want to ensure that the alerts that we have received is credible and is trustworthy. We only send real-time or close to real-time information via our email subscription list. But if you go on the dashboard, you'll be able to go back in time to view alerts that were submitted previously. And then that can guide your decision making or can, give you some more information as to what trends and patterns are in a particular period of time, the urgency of your response if you're just coming across that specific substance for the first time. Another information that we collect is the source of the alert, which is typically a credible organization. So harm reduction organizations provide us with anecdotal evidence again, and drug checking provides us with scientific data or substances that were checked by advanced technologies like FTIR machines, even test strips as well. So it provides, we only work with our partners, and they are dedicated to drug testing or harm reduction, and they provide a trustworthy foundation for the information that we receive. And you can also click on a link. We share a clickable link on the dashboard on our website so that you can find out more details and resources about our contributing organization. Indicates where the substance was found, which is essential for regional awareness and targeted harm reduction efforts in specific communities. This also means that there's a function on the dashboard for you to enter a specific location and see all of the alerts that have been submitted in that area. It's this practice or this function is essential due to the considerable variation in drug supply and associated risks among different communities. So while we aim to collect information on a national level, we want to be able to disseminate the information to be community specific. For example, it can also be used for tracking trends from province to province. There's been evidence of similar drug supply, not similar, but a connection between the drug supply in Alberta and British Columbia, for instance. So consequently, it's a high advantage for people in Alberta to also have access to a platform that consolidates all drug alerts from British Columbia, and the same for other provinces, for instance the Atlantic provinces as well. It is also a good way for each of those provinces to be conversant with what's happening in their neighboring province because of the connection in drug supply in province to province or community to community. This access will allow them anticipate or prepare for similar drug trends and risks in their region, enabling them make informed decision and effective harm reduction strategies. We also collect information with regard to what the drug was sold as in the community. Knowing what the code name might be helps in identifying and communicating about the substance more effectively. For instance, in this particular alert, the drug was sold as down, and we get a lot of alerts and reports of drugs being sold as down containing fentanyl, a benzodiazepine, like in this example, and xylazine. But what really makes some alerts stand out is if we know what it was sold as with regards to its code name or its street name. That way, it can also help users help them distinguish more and help them make more effective, informed decisions as to whether or not they should use a loan or use as a consumption site. But we always advise that you test your drugs. One of the main information that we convey with our alert system is the importance of drug checking, because the supply is increasingly unpredictable, and the best way to combine the information that you get from these alerts, the best way is to combine the information you get from alerts with drug checking. That way you are very well informed and knowledgeable about what is in the substance that you're about to consume. So there are different types of alerts. We have alerts submitted by harm reduction organizations. These are pop-ups from the dashboard. On the dashboard especially, it's very easy to identify or distinguish between harm reduction alerts and drug checking alerts. Apart from the fact that our harm reduction alerts are denoted with yellow pins on the dashboard and drug checking by red pins, you would also see in the pop-up that we compare the expected substance versus what we suspect the substance to be, or to be contained, or what the substance contains. So if it contains fentanyl, we just report as suspected substance because no test has been carried out on the sample, so we do not know the concentration. So we don't know if the entire drug is fentanyl or if parts of it contains fentanyl. Whereas with drug checking, we get the actual composition of the substance. So if it's suspected to be down, a drug checking alert will break down the actual composition of the down sample, and you can make your decisions from both conclusions still. So if in this example the drug was sold as MDMA but it was suspected to contain fentanyl, and we know this because it was linked to multiple poisonings and one known fatality. Another thing too is that the alerts on the dashboard contain slightly different information to what is being shared. Not slightly more, but I would say slightly more and less in some cases. So for instance here, we in the alert that would have been submitted via email subscription list, it'll tell you the number of units of Narcan that was needed to revive the individuals who suffered poisonings, but on the dashboard, for confidentiality purposes, it would not be highlighted. So that's how we came to the conclusion that this drug might contain fentanyl. Whereas in the drug checking example, confirmatory tests were conducted, test strips were used, and I believe in this alert as well, FTIR machine was also used to analyze the sample. It's just cut out in this particular photo. So the first website is Manitoba Harm Reduction network that provided us with this alert. And in the second example, it was from our partner organization, Get Your Drugs Tested. There are also other information that we include in the alerts, some notes, visual cues, the texture of the sample, especially when we cannot identify what it was sold as, what the street name would have been. So we also collect some other information, especially as well if we don't have pictures. So we try to be as descriptive as possible to help with identification and include additional details like risks and advisory notes related to the sample. Now, finally, we'll be talking about the dashboard that's hosted on our React and Reverse website. The dashboard includes several key features. Each is designed to enhance your understanding and interaction with the data. So formally, we just had a map on our website. So we have recently upgraded and optimized our dashboard to better understand and summarize our findings. We've also introduced a guided tour to provide a detailed step-by-step introduction to each of the components on the dashboard, just to aid users to effectively navigate and utilize our system. Upon first accessing our dashboard, a pop-up appears offering an introductory information about what to expect. Once the pop-up is closed, from the right corner, users can access the dashboard again, starting with the guided tour. The new summary section is a significant addition to the dashboard because it compiles alerts from harm reduction organizations where confirmatory testing was conducted, as well as those from drug checking organizations. This section is located on the left side of the dashboard, as we can see. We've also identified 4 key substances: fentanyl, benzodiazepine, xylazine, and instances where fentanyl and benzodiazepine were detected in the same sample where they were not expected. Remember earlier I said that we only receive anecdotal information from harm reduction organizations, but there are times when harm reduction organizations carry out drug checking, like using test strips. So they might not have FTIR machines, but they'll have test strips, and these classify as us knowing some more information about what the composition of the drug is. And we've added we've been able to report that by adding the summary section. So with the just the map, you can only differentiate between alerts that were submitted by harm reduction organizations or drug checking. So you can only differentiate by the type of report. But with the summary section on the left hand side of the screen, we can summarize by the type of report, if any confirmatory test or drug checking was carried out, such as test strips or FTIR machines. So the section is based on, for instance, fentanyl. Fentanyl, the first pie chart for fentanyl will present the percentage of alerts where fentanyl was found to be in the substance when it was not the expected substance. So if we have 47% of our fentanyl samples, for the fentanyl pie chart, it means that for 47% of the alerts that we receive, fentanyl was not expected, but it was in the substance. We also have other sections of the dashboard that is also important. We have our date filters, as well as our service filters. So like I highlighted earlier, the harm reduction organizations, the alerts that are submitted are denoted by yellow pins, and those submitted by drug checking is denoted by red pins. And if you want to find out alerts that were submitted by only drug checking organizations, for instance, for a select period of time, you can use the date and the service filters to filter for that specific information. So this is just a demo of the select dates filter and the select service. So when you click on the guided tour, you can use the previous or next buttons to navigate to different sections of the map. That way you can get more information about what that section provides. So the right hand side provides a more simplified version of a summary of all of the reports that we have gotten. Also helps to re-emphasize the difference in colors of the harm reduction organization alerts and the drug checking alerts as well. We also grouped the alerts submitted by province or territories with this bar chart, so you can click on any of the bars to get information on a specific province. You can also click and hold to select two different provinces, for instance, and you can see that the dashboard, how the dashboard interacts with that section. We also have some map controls. I'll go back a little bit in my recording. Oh, oops. So we have some map controls. We have the home button, which returns you to the initial extent of the map. We also have the location button, which helps you type in a specific location, and the alerts that were submitted in that area would become visible on the map. We also have a new addition, which is the map control pin cluster. So for instance, we've started noticing that various communities are sending in multiple alerts, and it was difficult for people who use the dashboard to identify if a particular region had received multiple alerts. So we now have a pin drop cluster, so it displays an expandable list of reports that have been submitted in that area, and each individual report includes the name of the partner organization, date of report, and other sections of the alert. And this just shows you a drug checking service report because it's denoted in red, and a harm reduction report denoted in yellow. I'll let that play. The next is our alerts submitted by dates. So it just shows a trend of alerts that have been submitted. We generally have seen a peak towards the colder months, with the exception of May and June, just the beginning of summer, where we've received the highest number of reports. In summary, our National Drug Alert System is designed to be a comprehensive, user-friendly tool for community safety drug harm reduction, informed decision making, and is a dynamic platform that combines both anecdotal insights and scientific data to provide timely and relevant drug alerts. As we continue to enhance and expand our system, we remain committed to providing valuable information that helps users navigate the complexities of the unregulated drug supply in their communities. If you have any questions, you can feel free to ask now, and you can also send your questions to the Summit's SJA, the Summit's at sja.ca. Someone will put the right email in the chat for you, and we'll be happy to address any questions or feedback that you may have. Thank you for listening.